Hello everyone, I'm Kelly Barnett. Welcome to my channel Instant Healthcare, where I share simple tips, expert advice, and motivation to help you live a healthier, happier life. Today, we're diving into a topic that's close to my heart, both literally and figuratively: heart valve disease. Understanding the signs and symptoms of this condition is crucial. It's about empowering ourselves with knowledge that can potentially save lives. Throughout this essay, we'll break down complex medical jargon into easily digestible information. We'll explore the importance of recognizing the symptoms of heart valve disease, a condition that often flies under the radar. So, let's embark on this journey together, arming ourselves with the knowledge to protect our most vital organ: the heart. Heart valve disease is often called a silent threat. Why? Because it can develop gradually, with subtle symptoms that are easy to dismiss. But make no mistake, this condition is serious. It affects the heart's ability to pump blood effectively, potentially leading to life-threatening complications. Early detection is key to managing heart valve disease and preventing further damage. By understanding the symptoms, we can take proactive steps towards safeguarding our heart health. Remember, knowledge is power. Let's empower ourselves with the information we need to recognize the warning signs and seek timely medical attention. Imagine your heart as a four-chambered pump, with each chamber separated by a valve. These valves, like one-way doors, ensure that blood flows in the right direction. Heart valve disease occurs when these valves become damaged or diseased. This can disrupt blood flow, forcing the heart to work harder. There are different types of heart valve disease, including stenosis, which is the narrowing of the valve, and regurgitation, where blood leaks backward through the valve. Understanding how these valves work and the problems that can arise is essential for grasping the significance of early detection and treatment. One of the most common symptoms of heart valve disease is shortness of breath. This can manifest as difficulty breathing, especially during physical activity. Imagine climbing a flight of stairs and feeling unusually winded, or struggling to catch your breath after a brisk walk. These could be signs of your heart struggling to pump blood efficiently. As heart valve disease progresses, shortness of breath can even occur at rest. This is a red flag that should never be ignored. If you experience persistent or worsening shortness of breath, it's crucial to consult a healthcare professional for a thorough evaluation. Section 5. The fatigue factor: unexplained tiredness and weakness. Another hallmark symptom of heart valve disease is persistent fatigue. This isn't the ordinary tiredness you feel after a long day. It's a profound exhaustion that lingers, even after a good night's sleep. This fatigue stems from the heart's inability to circulate oxygen-rich blood effectively. As a result, your body's organs and tissues don't receive the energy they need. Simple tasks, such as walking short distances or carrying groceries, can become surprisingly difficult. If you're experiencing unusual fatigue that interferes with your daily life, it's essential to seek medical advice. Remember, fatigue is your body's way of signaling that something is amiss. Don't ignore these warning signs. Section 6. Beyond the common: unmasking the atypical symptoms. While shortness of breath and fatigue are the most prevalent symptoms, heart valve disease can manifest in other, less common ways. These atypical symptoms are just as important to recognize. Some individuals may experience chest pain or discomfort, similar to angina. This occurs when the heart muscle isn't receiving enough oxygen-rich blood. Others may notice swelling in their ankles, feet, or abdomen. This is due to fluid retention, a common complication of heart failure, which can be caused by untreated heart valve disease. It's crucial to remember that heart valve disease can present differently in each individual. Don't hesitate to discuss any unusual symptoms with your doctor. Section 7. Living with heart valve disease: real stories, real impact. This is a journey into the lives of those who face this condition every day. Let's put a human face on this condition. These are not just statistics, they are real people with real stories. Imagine a marathon runner, once full of energy, now struggling to climb a single flight of stairs. The transformation is heartbreaking and profound. Or a new mother, too exhausted to care for her newborn. The joy of motherhood overshadowed by relentless fatigue. These are the real-life consequences of undiagnosed and untreated heart valve disease. It affects people of all ages and backgrounds. It can rob individuals of their vitality, their passions, and their ability to enjoy life to the fullest. Imagine missing out on family gatherings or being unable to participate in activities you once loved. Studies have shown that early detection and treatment can significantly improve quality of life for those living with this condition. Medical advancements have made it possible to manage and even overcome many of the challenges posed by heart valve disease. It can mean the difference between a life limited by fatigue and shortness of breath and a life filled with activity and joy. Imagine the relief of being able to play with your children or go for a walk without feeling exhausted. Remember, you are not alone. Support groups and communities are here to help, offering comfort and understanding. Millions of people worldwide are living with heart valve disease. They are your neighbors, friends, and family members. By raising awareness and encouraging early detection, we can make a real difference. Together, we can support those affected and work towards a healthier future for everyone. Section 8. Irregular heartbeats and swollen ankles. Subtle signs, serious concerns. Irregular heartbeats, also known as arrhythmias, can be another subtle sign of heart valve disease. These irregular rhythms can manifest in various ways, such as a fluttering sensation, a racing heartbeat, or even a slow, irregular pulse. These irregular rhythms can feel like a fluttering or racing sensation in your chest. Sometimes they may be accompanied by dizziness, lightheadedness, or even fainting spells, which can be quite alarming. While not all arrhythmias are cause for alarm, they can be indicative of underlying heart conditions, including valve problems. It's crucial to pay attention to these signs and not dismiss them as mere stress or anxiety. It's essential to get checked out by a doctor to determine the cause. Early detection and treatment can prevent more serious complications down the line. Swollen ankles, feet, or abdomen, medically known as edema, occur when fluid builds up in your body's tissues. This swelling can be uncomfortable and may worsen over time if left untreated. This can be a sign of heart failure, a potential complication of untreated heart valve disease. Heart failure occurs when the heart is unable to pump blood efficiently, leading to fluid retention and swelling. If you notice persistent swelling, especially if accompanied by other symptoms like shortness of breath or fatigue, seek medical attention promptly. Early intervention can make a significant difference in managing your heart health and preventing further complications. Section 9. The importance of early detection. Your heart's cry for help. Early detection is paramount when it comes to heart valve disease. This silent condition can progress without noticeable symptoms, making it even more critical to catch it early. The sooner the condition is diagnosed, the better the chances of successful treatment and preventing further damage. Early intervention can mean the difference between a minor procedure and a major surgery. Regular checkups with your doctor are crucial, especially if you have risk factors such as high blood pressure, high cholesterol, or diabetes. These conditions can significantly increase your risk of developing heart valve disease. Additionally, a family history of heart disease can predispose you to similar issues. Knowing your family's medical history can help your doctor assess your risk more accurately. Don't hesitate to discuss any concerns you have about your heart health with your physician. Open communication is key to effective healthcare. They can perform a simple listening exam with a stethoscope to detect any heart murmurs, which can be a sign of valve problems. This non-invasive test can provide crucial information about your heart's condition. Remember, your heart is speaking to you. It may not always be loud, but its signals are important. Listen to its whispers before they become cries for help. Taking action now can save you from more serious health issues in the future. Section 10. Seeking medical advice. Your path to timely intervention. If you experience any of the symptoms we've discussed, it's crucial to seek medical advice without delay. Your doctor will conduct a thorough evaluation to determine the cause of your symptoms. This may involve a physical exam, listening to your heart with a stethoscope, and ordering tests such as an echocardiogram, which uses sound waves to create images of your heart. Based on the diagnosis, your doctor will recommend the most appropriate treatment plan. This may range from lifestyle modifications and medications to minimally invasive procedures or surgery. Remember, timely intervention is key to managing heart valve disease and preventing serious complications. Don't wait until it's too late to seek help. Section 11. Join the conversation. Your heart health matters. Thank you for joining me on this journey into the world of heart valve disease. Remember, knowledge is power, and by understanding the symptoms, we empower ourselves to take charge of our heart health. Share this information with your loved ones. Together, we can raise awareness and encourage early detection. Now, I'd love to hear from you. Have you or someone you know experienced heart valve disease? What steps are you taking to prioritize your heart health? Let's continue the conversation in the comments below. Like, share, and subscribe to stay informed and empowered. Your heart will thank you for it.